Welcome to the Hanley Effect, a podcast by the Hanley Foundation designed to educate, change minds, and save lives. Our goal is to inspire you, showcase our innovations, and change the conversation about addiction and mental health. Join us as we unravel stories of resilience, recovery, and hope.
Hi, everybody. Welcome again to the Hanley Effect. Hi there, Dr. Dosicle. I don't know what just happened. It's one of the, we're filming this later in the afternoon.
Okay.
And so it's been a day, and my ability to speak has clearly gone away.
So this lets you know how authentic we are.
That's right.
Other podcasts would have said, halt, let's start again.
Edit it out. No, this is just who we are.
Hello, Dosker Dibin.
Well, it's Divin and Disco anyway.
Yes, anyway.
So I'm bringing that back.
So I'm taking control and I'm doing the intro to this time.
Do it.
I was going to say today, but today and this time, same thing.
I can't wait.
Okay, so we have right now in the studio with us my absolute favorite person on the planet. And let me just focus in on that a little bit. She is the human that fills up my gas tank. So Lyanne Azqueta, she is a longtime member of our board. She is one of the leading therapists worldwide. Amazing knowledge. Worked for Hanley. We talk about all roads lead back to Hanley. Right. But you are probably the smartest human I know. And she is all things behavioral health, and you are with us today. Welcome. I'm so glad.
As I always tell Rachel, I am here for Hanley in whatever way that I can, because nothing fills my gas tank more than being with Rachel and now being with John Dibin. And more than that is being with addicts in general. Mm-hmm. If you really want to meet incredible human beings, creative human beings, smart human beings, and people that are willing to transcend and become really the best that society has to offer, yes, you start working with addicts and you begin to see them change their lives and become just amazing people that can just change the world.
Mm-hmm. Mm-hmm. And what do we know? We know that many addicts, most addicts, let's say it that way, are super smart, super creative. I mean, the smartest person in the room for sure, typically. So tell us a little bit about your story and your early years at Hanley.
So I'm sure Dr. Dibin would love to hear this.
First of all, I always love to hear the history, but yours in particular, I've been excited about.
It's amazing.
So I don't know if Dr. Dibin's talked about his whole spiritual journey, but without spirituality, you have no recovery. Mm-hmm. And so I had a big spiritual awakening, and I changed careers. I was studying business, and I started studying I got a degree in religious studies, and I thought I was going to teach. And so I did that, and I decided that teaching high school is really difficult.
I think that's the understatement of the century.
So I transferred over and went into behavioral health. And during that time in the very, very early 90s, the only place that you could talk about spirituality was with addiction. Yes. And so I got into working with addicts. My first job with addicts was at the maternal addiction unit at Jackson Memorial Hospital in Miami. Mm-hmm. And just incredible human beings, and just so many lessons to be learned from them, and such a push for my own growth. And so that's how I got into working with addicts, and how I got to love them so much.
Love is so clear and so evident. A while ago, we had this year, actually, we had Jeff and Deborah J were on, and Deborah always talks about the beloved alcoholic. And it's funny that all the terminology, we always use different terminology, and we're always working to move away from stigma. And so we talk about, you'll hear people talk about, we'll change. We won't use the term addict anymore. Now we use the term person with addiction and such. And there's a lot of validity and good things, but I think more than anything, and I get this from you, and I think about that beloved, that idea of beloved alcohol, it is more important than anything is what we're actually saying. And what I'm hearing is that persons, whatever the terminology is, that these are people, everybody is worth the investment, is worth love. And when we pour love into people, that's where the power to change and heal comes from. I love that.
Yeah. And Jeff and Deborah are incredible. Jeff is the epitome of the person that will exemplify the fact that treatment works.
Yes.
Right? You just can never, ever give up on anyone. Jeff is a perfect example of that. I got the privilege of working with them, and Deborah is amazing because she is just really good at holding space for them to become who they are, right? So I think that both of those are just incredible examples of how treatment works, and how you just can't give up, and how you have to continue believing.
So how'd you get to Hanley? You're at Jackson working. How'd you get to Hanley?
So at that point in time, Hazelden was the Oompa Oompa.
Yeah.
They printed the big book. They were the people. And so I showed up at Hanley and I said, I will do anything to work here. I will work for free. I will do whatever you want. I just want to work here. And so they gave me the opportunity. I started working for free, and it didn't take very long for me to become a primary therapist. And I worked on the women's unit for many, many years. And back then, you'd get overflow during the holidays, as you always do. And so I carried men as well, and then eventually ended up at Fellowship, which was their halfway house. But Hanley always took care of their employees. And so it was really amazing because the culture that exists at Hanley was really about bettering everyone. Yes. And so their educational program was top notch. And I got to train with not only the best that we had in Florida, but I traveled all the time to Minnesota and was able to train up in Minnesota. And I got the opportunity to travel to Central America many times and bring our model to Central America and work with doctors there. So that educational piece has always been hand in hand with growth for everyone, not just the patients, but also for the staff.
So for our listeners, Hanley for, I guess, about 20 years was Hanley Hazelden. Right. And then it became just Hanley, but, all of those same cultural pieces, continued. And we have great respect for the work that's done at Hazelden. Yes. I
tell people all the time, and I've been, there since when we were Hazelden, and when I came there, we were Hazelden as well. And it is interesting over 20 years, seeing all these different changes in culture, changes in our organization as well. But there is a just kind of a root of good, high quality, ethical treatment that you're exactly right, that we really respect and honor what, even though we've come so far, in the past 20, 30, 40 years, but that foundation that Hazelden gave us. I'm glad you said that, because we've always had that kind of laid a foundation for us that has just maintained some great care over the years.
So, Lyanne, one of the things that you do so well is you inspire hope. And I mean, it radiates off you. Yeah. Tell the story about what you would keep in your desk for patients as they were leaving.
Well, not for all patients, but if I was ever really worried about a patient who I just saw such enormous potential, and one of those that really had a lot of determination and grit, those patients that when they were young were called rebellious and difficult and, patients that just were resistant to treatment and change, right? But that had quite that part of their ego and their pride that was there, right? And so I knew that if somebody gave them a challenge, they were going to meet that challenge, right? And so it's like anything. If you have high expectations for someone, they will meet those expectations. Yes. If you have low expectations for somebody, they will meet those low expectations. Right. And so a lot of times what happens in treatment is that when they don't follow recommendations and they do certain things that you're recommending them to do, which would be, of course, the easiest path. Many addicts don't like the easy path. And so they would, I would take their coining out ceremony coin, and I would put it in a little envelope, and I'd say, if it was you, John, I'd say, John, I'd put the date, and then I'd put the date in 6 months. And I said, this is in my drawer. And if you come back in 6 months and you're still sober, I will make sure you get your coining out ceremony. And when I told this story recently, somebody's like, oh, how many coins did you have left? And I was like, barely any. They would come back. Wow. They would grip onto the 12-step program, and they would get better, and they would change, and they would come back, and they would say, every time I'd want to go out and use, I'd remember what you told me. And what I would tell them was always this. Yeah. I'm not here to get you sober. I'm not here to put you in recovery. I am here to ruin your use when you go out and use in the future. And so you listen to my voice when you're out there thinking you're going to pick up or you've picked up, and you can always come back. Yeah. And so they did. And it was an amazing thing.
Yeah. You create hope. You create hope.
Yeah, I think it's more about believing, right? So I always say that love is a one-way street. And one of the things that I learned when I lived in Italy is, they have romantic love, te amo, but they have love, which is te voglio bene. And that means I wish you well. Mm-hmm. And you can always wish somebody well, because everybody, even your worst enemy, deserves that chance to change, right? And
that's beautiful.
It's beautiful.
Yeah. That is beautiful.
Yeah. And that comes from an author that was really big in the 80s. His name was Leo Pubscaglia. And he used to say, just because you know me today doesn't mean that you'll know me tomorrow. I am an ever-changing and evolving human being. And that's who we are. And that's the opportunity that every addict needs to know is available to them.
Yeah. And this is why she fills up my gas tank.
So I remember when I first met you, actually encountered you, because you left Hanley Center right before I came there, because people were like, how could you not know her? You've been there forever. But you were there even before. Mm-hmm. But the first time I encountered Lyanne was I was invited for some reason to be at a Hanley Foundation board meeting with all these fancy schmancy people, and they would all talk about recovery and different ideas, and then Lyanne would say something. You'd say something, and I remember going kind of my ears going up, going, man, I gotta talk to her. She sounds like a clinician, right? And of course, then I learned, they're like, that's because she's a clinician, right? So you went on with your career. You eventually became a licensed psychotherapist and a mental health professional. What was that journey like, moving from, just focused on addiction only, and then really kind of, at some point you had to expand your education, your training to look at mental health in a bigger picture?
So Hanley gave me a really big gift, and it gave me a framework. I was very young. I was straight out of grad school when I arrived there, and I encountered this employee in Minnesota that did a training once, and his name is Craig Knockin. And Craig Knockin gave me the gift of giving me a framework for life. And that framework is very simple. He taught us that all individuals need 4 things to be healthy. And those 4 things are simple. And when we're in our addiction, most of them are not there, and they need to be balanced. And those 4 things were a relationship with yourself. You know, when you're in your addiction, everything is good or bad, and the answer is always to use, right? So what is going on with me? What am I feeling today? You know, I get very affected when there's no sun out. I'm a good Florida girl, so I get tired and sad. So I know that about myself, so I know I need to do some extra TLC on those days for myself. The second one is a relationship with family and friends. Not necessarily blood family, but people who you are not afraid to show yourself to. If I tell you who I am not afraid that you're going to abandon me. And they have the same. If you come to me and tell me who you are, I'm not going to abandon you. I'm going to see you for who you are. The next one is spirituality, something beyond my senses, something that might even start for us in treatment as good orderly direction and a basic connection. And then the last one is community, something that I give freely to and something that I receive freely from. And there's many places to find those. Many healthy individuals don't have AA, but definitely AA is the place to find all 4 of those things when you need them. And so that became my framework. And the second part of that is, how great would it be if we could prevent people from getting into this disease? And so I spent a lot of time working with that. I run a school in Dominican Republic with 2,500 students, soon to be 3,000 students. I run an after-school program near here in Pahokee. I'm on the board of a charter school, and of course I'm on the board of Hanley, which is my deep passion, right? But if you can prevent that, and you can really show individuals that they are worth being seen and they are worth being loved, that really creates a generational change. And one of two of my greatest passions are happening at Hanley now, and so I am really happy to be in a place in my life where I can get more involved with Hanley and be there more.
So Lyanne, and this is a perfect jumping off point, you have a specialty in women's trauma, in women and women's trauma and perinatal women. Talk to us about that. You're also the mother of a daughter who is delicious and flourishing and incredible. But talk about that work with women. You know, we say at Hanley, women are sacred. Women are sacred. And, you know, you have really come in and helped us to launch this perinatal pilot. And but how did you get into this work with women?
So, you know, I as I said, I worked at the maternal addiction unit, and so it was really powerful for me to see that, right? And it was really powerful during that time in our history. You know, we had a lot of HIV babies, we had a lot of crack babies, and one of the jobs that I had at the unit was to spend some time holding those children, right?
Oh, I remember this story.
And so that becomes such a powerful thing. And there's something about girls from birth, right? I come from an all-male family. I have 4 brothers. I have my mother comes from an all-male family. She has 4 brothers. But boys are a little different. When you hold a baby girl infant in your hands and you look into her eyes, she will look back at you, and she will create a sense of intimacy that is beyond anything, right? And unfortunately, many of these women that we talk about when we talk about treatment is that I define trauma as a rupture of love. And unfortunately, their sense of love has been ruptured many times throughout their time, right? And so with that, if you can bring that back, that innate love and intimacy that women can provide, first to themselves and then to others, then it becomes a very powerful experience. And with these women that are pregnant, with these women that have just had a child, the unification of that mother and child becomes one of the strongest outcomes for them to be able to stay sober. Yeah. And anytime anybody gets sober, male or female, we have Patriots program going as well. Right. So veterans and first responders and anything else, you create a person that will leave a wake. Right. And as I tell the kids at our school, you need to choose in life. You can be a buoy or you can be an anchor. And you need to choose who you're going to tie yourself up to, a buoy or an anchor. And so all of these people are buoys. And these women become those buoys for these infants. Yes. And those infants become the buoys for their mothers.
That's it.
And Lyanne, you are the buoys for many, many, many members of our clinical staff. And so I hope you don't mind my sharing, and you know this, one of the things that you do so well is service. You've talked about your service in Dominican. You've talked about your service in Pahokee on our board. But right now, you are providing service in a way that is beyond anything to our staff at Hanley. So you are bringing your expertise to our newbie interns who are just, right out of grad school like you were when you came to Hanley, all the way through our expert clinicians and really helping those people realize their gifts. Talk a little bit about that.
So Hanley is just an amazing place because when we reacquired Hanley, there were times when Hanley was not as an amazing place as it is now, right?
It was a for-profit for 10 years.
Yeah, so I'm very big on this. Even when we were touring schools with my daughter, it's important to go to a nonprofit school. It's important to go to a nonprofit hospital, right? Nonprofit hospitals are teaching hospitals. They're in the cutting edge. And so, and they have a different viewpoint. They look at you as a human being, and it's not about what they can get out of you. And they have really important aspect that we do here at Hanley, which is so important, which is we have an amazing admissions team, and it is run by an amazing woman who really is able to look at each case that gets called in and is like, okay, we treat a lot of things here and we can help in a lot of ways, but we're not the end all be all. And so this might not be the best fit for you. Maybe you come and you detox with us, and then we'll send you to the best fit and chance for you to get sober. And so that's a real gift. It's a different way of looking at treatment because it's really centered on the patient.
Yeah.
And so from that moment of admissions, which is such a powerful connection, and anybody that's listening to us that just has a question and maybe isn't ready, call admissions.
That's right.
They will walk you through it. They're always a person with knowledge that can help you, with the resources you're at the moment willing to use, and maybe in the future willing to do more, right?
Yeah,
they start somewhere.
They spend a lot of time talking to people that they know right away they're going to be going somewhere else, and they help them get there. That's our ready. Yeah, and that's that team's mandate. Yeah. You're absolutely right.
Yeah. From that to, we have a wonderful new clinical director who's brought in a lot of different aspects and tracks and is leading with that. And what's really incredible about him is that he's really willing to look at what is best and what can we provide.
Right.
And he has wonderful people that work with him that he leads. And there's, a spitfire of a senior clinical director who is really just,
so great.
So great. She is the epitome of like what you see is what you get.
Yep.
A great, wonderful history on learning how to be mindful and calm when that is necessary, and really is a team player and works well. So, from that area, you have those individuals. You have a new director on the men's unit, and she is absolutely incredible, and in the process of really honing in and working on not just men's recovery, but the Patriots program, and creating something that is completely different from anything that is found in any of the VA hospitals, which are mostly reliant on drugs. I mean, they are all about treating the trauma that these veterans have gone through, and she's doing a fabulous job with that. We have Dr. Betancourt with the core and older adults who is amazing, because they are boomers. They used to be the boomers program at Hanley, right?
That's right.
And now there are older adults. And, I can think of just a person I was talking to yesterday, and seeing her clear up. Right. And really looking at the fact that maybe it's not dementia or Alzheimer's. Maybe it's just alcoholic fog. Right. And really being able to separate that and get them on their way. And that's just great. We have the Headwaters program, which is really just an incredible group of individuals and very prepared staff there. All the way down to, one of them being an art therapy specialist and working in brain spotting and different things, amazing things. And then where I spend a lot of time, which is the women's unit, and you have somebody who has worked through the court system in the unification process of families. And that is such an important aspect, right? A very wise clinician in her experience with kids and families, and real advocate for those that have lost their way, and DCF has gotten involved, and then others that are just women and mothers, and they're creating that, right?
Yeah.
And then my favorite, right, which is what Dr. Diven does, and he's going to make my dream come true. I'm saying it on air now, right? Because my dream is to actually work with one of the leading experts in the world with kids. And that program is just the most amazing thing, because if you can touch a child between the ages of 7 and 12 before they're actually using and experimenting, and teach them how to talk, how to communicate, how to really value themselves and see the world, you are just creating an amazing opportunity for change. And there is nothing more powerful for any of the parents out there than for your child to come in to teach you something and remind you of something that you may have forgotten or lost your way or gotten emotional about.
That children's program, what has surprised me is we all know it's an incredibly great thing for kids, but it's a gift to the parents and the guardians as well. Can I ask a personal question? I'm going off book.
Oh, shoot.
So I want to paint a picture. You are a licensed psychotherapist. You are credentialed. And you won't like this, but you are a very important person to a lot of people. You are on the board of this organization, and you go in as a therapist, and you tell everybody, you tell us exactly what you think, what you see, but you're even now, when Dr. Dosical asks, what's it like for all the service you're doing? You immediately go to talking about everything that everybody else is doing. And I'll tell you, I'm going to tell a secret. So when there are a lot of therapists that were nervous, they're like, oh my gosh, a board member somebody from our board is going to be here, like working with us, or, clearly they're going to tell us what to do, and clearly they're going to be looking for everything we're doing wrong. And oh my gosh, you are the opposite. You're not playing it. You really don't like to brag. You really don't like, you really do have this heart for building up others. And to be clear, you're a strong personality. You've got opinions and we'll know them. But you approach people, the therapists love working with you. People who you give feedback to love hearing it. You truly have a servant's heart. Like you really, really are. And I've never asked that. Where does that come from? Were you born that way?
I think that what happens, right, is that when you go through looking at what are your values in life, right? And I live a very values-driven life, right? And as I said at the very beginning, spirituality is extremely important to me. And so part of my values is to show up, right? And so if you're going to show up, you have to show up in all aspects. And so in my spirituality, I show up. Yeah. And I surrender myself completely to God every day. And I ask him to take care of everything, to use me the way that he wants to use me. And I love the fact, I love Mother Teresa. I think that if there was a servant's heart, Mother Teresa was that, right? Yeah. And so Mother Teresa had two stories that for me are very important. And one of them is that she would talk about us being a pencil, right? And so when we hold the pencil with God, beautiful things come out. But when we try to take control of the pencil and we are fighting with God, we make a mess. Yeah. But God gives us this very nice eraser at the other end that we can erase and start over, right? And so I think that that's part of that, right, is that we need to be in sync. And if we're in sync, then I can provide what is my biggest and greatest joy in life, which is to introduce people to God. And for me, that introduction to God is to just show them that they are loved and they are seen and they are valued. Because every single person in my belief and my faith is that was created and was meant to be here and was given very specific gifts. And so that truly is where I come from. And so I show up every day for God and I spend my time in prayer, really trying to get to know that process.
Yeah. In a time where there's so much turmoil and there's so much, I that's inspiring to me. That is inspiring to me to remember what it means to be a servant, but to be a person, to be a person of faith. It's not about making anyone else think anything else. It's about being that love for others, and through that love, showing people that they're worth something. Thank you. Thank you. That's just beautiful.
It is beautiful.
Sorry,
it's like complete mic drop. I'm not even sure what to say at this point. It's incredible.
It's a good thing we're out of time. Because
so good.
But I really appreciate that, and I hope people listen to that. And this is one of those moments I'll listen to again and again, because that level of genuineness and a depth of a real a seeker just is something we don't always get to experience. But that helps me understand why I'll see you walking around the campus. She's got her backpack on, and she looks like a grad student.
Yes, yeah, you do.
And because you're just going and going and working, and you're just so full of joy in it, and you could easily. It just is a beautiful thing. You could look down on people if you want it. You could be like, I'm so much, and you just love being with people. You have a genuineness that I just really appreciate. I'm rambling now, so I'm gonna do our wrap up.
Okay, do our wrap up.
Because what we always like to do is we like to give our guests the last word, and so I just want you to think about the audience. And it's wide. There are therapists. There are people who don't know anything about therapists. There are people who listen that know about addiction and mental health. There are lots of people who don't know anything about it. There's family members. Thinking about this broad group of people, we want to just, what is one thing that you would want our audience to hear from you?
I think at the end of the day, it's exactly what we've been talking about this entire time, is that every single person has value. Every single person has the ability to become the best that they can be. And if we can be a part of their journey, even if it's for a little bit, even if it's just a smile, right, that you can give somebody and help them feel like, oh, look, somebody has noticed me. So many of the individuals that come into Hanley have had such difficult lives, and really just have never felt seen or loved or wished well, and they really think there's nobody out there for that, right? And they've created, therapeutically maladaptive coping mechanisms that really just, don't work, but did work at some point to get them through. Right. And so if you can just stop and let them be seen, they will show you a part of life that is just incredible. Yeah. Because we all, no matter what our experiences, we all share the same feelings. And if we can connect at that feeling level, no matter what the story is, we can really connect and be a part of something bigger.
Yeah. Thank you so much. What a way to end an afternoon. Yeah. Dr. D.
Thank you, Lyanne. You are incredible.
Not half as incredible as the two of you, so the Dr. D's.
Dr. D.
Dipping in disco.
Oh,
well, Dr. D, thank you.
What was it at the beginning?
I don't know. I couldn't talk, but
I can't even remember.
I'm not going to thank you for being here if you keep picking on me.
I have to pick on you. That's my role.
Well, thank you then. And I'll get some love from Lyanne later, and I'll feel healed, thank you, everybody.
At least you're seen by me.
That's true. One way or another. Thanks. Love you. Thanks, everybody, for listening and for being part of this. And we'll see you next time on The Hanley Effect.
Bye, everyone.
Thank you for joining us for The Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.